My New Year's wish list for healthcare. Number 1, healthcare information technology. Hopefully hospitals will start working towards optimizing healthcare IT with frontline clinical workflow. What we have right now, and I speak as someone who has worked in several different hospitals with lots of different electronic medical records, is for the most part slow, inefficient, and cumbersome to use. It takes time away from patients and causes great frustration for both doctors and nurses, who are spending less and less time with their patients. For the sake of good medicine and also pleasing our patients, we need to design better IT systems, move away from click-box medicine, and ensure that healthcare IT does more than just satisfy administrative requirements. Even the most hardened technophobe would agree that IT is the way of the future, so let's make it better. Number 2, patient safety and healthcare quality. Great strides have been made in this area over the last decade, but we need to make sure that the efforts are both effective and meaningful. Many of the same unsolved problems exist as they have for the last several years, such as improving medication reconciliation and the discharge process. Number 3, patient satisfaction and improving the hospital experience. Ask any patient what they really want from their hospital stay, and the answers are usually extremely simple. Things like increased face time and better communication with their doctors and nurses, clarity on wait times, and the ability to get a good rest while in the hospital. Hospital administrations across the country need to focus on the real fundamentals of good hospital care and move away from patient satisfaction just being a bumper sticker. Get these things right and huge rewards are to be had. Number 4, direction of healthcare consolidation and private doctors. I first came to the US to start my residency in 2005, at a time when the current crop of changes to healthcare was just beginning. I did my residency training in Baltimore and have since worked up and down the East Coast. Having come from a very different type of system, the United Kingdom, one of the first positive things that struck me about the US system was the dynamism and the independence of US physicians and the choice and flexibility this gave to patients. Over the last decade, there's been a relentless push towards consolidation and employed doctors. Solo and small practices are finding it increasingly difficult to thrive. I sincerely hope that the pendulum begins to swing back the other way, because I feel this will be better for both patients and physicians. The question is, can we do this with the added need to also control costs? I hope so. Number 5, healthcare costs. Sticking with the last point, I don't believe that the need to control costs necessarily means that there has to be a stark choice between the current US model of healthcare or moving towards a heavily centralized system that exists in certain European countries, with all of the restrictions, control, and rationing that goes with that. There are several hybrid models that exist, such as in countries like Australia, where I've worked as well and seen excellent care being delivered. My hope is that we can reconcile the need to control costs without adopting a more controlled system where physicians and patients feel their choices and freedom are limited. So there we go, my New Year's wish list. The best people to make healthcare choices will always be the patient and their doctor, and this relationship always needs to remain front and center of any healthcare system. Whatever the new year holds in store, especially with all of the political changes happening, physicians need to work together to ensure we move in the right direction and make healthcare better. A very happy new year.